Yeah, right. Yeah.
Okay. So my name's Lane Piper. My group is going to be talking about the diagnosis of Voldemort, the character from Harry Potter. So here's a little introduction on him. For his upbringing, before he got his notorious name, Tom Riddle was born in an orphanage in London. So his mother, she became very sick, and she was so heartbroken over his father leaving her that she refused to heal herself, even though she had the capability. And Tom's father was a non-magical person called a Muggle, who didn't love her and had no interest in having a baby with her. When she stopped putting a love spell on him, he left them and wanted nothing to do with them. So basically, Tom Riddle's entire childhood was raised in a really rough London orphanage, and he didn't really have any love or parental attention. So at a very young age, Tom realized that he was different than all the other kids. He could, move objects with his mind, cause them to float, and manipulate animals and people to do the things he wanted. After getting into a fight with another orphan, he used his powers to hang the boy's rabbit from the rafters. On one occasion, he took 2 other orphans into a cave where he performed acts that were never spoken about, but they were so traumatizing that these children never spoke to anyone and they were never the same. And he also stole things from the other orphans and hid them in his cabinet. So this is a quote from Tom. Should we talk to her?
Yeah.
So his upbringing continued. This is just a quote from Tom Riddle. He said, "I can make things move without touching them. I can make animals do what I want without training them. I can make bad things happen to people who are mean to me. I can make them hurt if I want to. I can speak to snakes too. They find me, they whisper to me." So here are Tom's Hogwarts years. He was educated from 1938 to 1945. During this period, he was really popular. He convinced all of his teachers that he was a model student because he was really charming and knew how to speak to people. He also had the appearance of having friends. Like I said, he was really popular. He always had people following him around because he was really gifted. But in his own words, they were simply the weak seeking protection, the ambitious seeking some shared glory, and the thuggish gravitating towards a leader who could show them a more refined form of cruelty. So himself and his followers, they began terrorizing other students like very early on his educational career. But they were really adept at covering their tracks because his manipulation was so deep-seated in everyone that they never suspected him of doing anything. So during his time at Hogwarts, he really wanted to find out his familial heritage. He ventured to his hometown where his mother was raised. And there he met his Uncle Morphin, who explained that Tom's father was a non-magical person and that he broke his mother's heart. So he was incredibly angry to find out that this was his history because he had always thought that he was like a pure-blood wizard, which means both of his parents were magical. And that obviously his father was the reason his mother killed herself. So Tom went and found his father's home and murdered both him and his father's parents, or his grandparents. And upon returning to where his uncle was, he blamed his uncle and framed him for the murders. And his uncle actually ended up spending the rest of his life in prison. During his 6th year at Hogwarts, he became completely enthralled, obsessed with immortality. And he used charm to manipulate one of his professors into telling him that by murdering someone, he could split his soul and live beyond his own body. So at 16, Tom ventured out and committed his first murder. In his adulthood, he went on to create 2 wizarding wars. The first was strictly based on his desire to outlaw anybody who was of unpure blood, which again is anybody who was not from 2 magical parents. The second wizarding war was retaining the same idea. He still wanted domination. He still didn't want anybody who was not of pure blood. But it was also based on killing a child, Harry Potter, who was believed to be the only person who could kill Voldemort in the long run. In these years, he killed thousands and thousands and thousands of people, children, mothers, and he just completely lacked any regard for life and was totally willing to murder anyone who got to his way.
Hi, my name is Juno Lee, and I'll be doing the diagnosis for Tom Riddle.
All right, so I guess starting off with just a few basic biopsychosocial observations. First is the only biological information that's given about Tom was that his mother was a witch and that his father was a muggle, or in other words, a non-magic person. And he was abandoned by his only living parent at a young age, and he was placed in an environment where he experienced neglect and did not receive an adequate amount of care or affection. And once he realized that he had a unique ability, he became obsessed with his power, and eventually that obsession developed into one that desired immortality. And he would significantly harm other people who would get in his way, and his obsession continued to grow as he got older. So the following diagnoses are ones that we considered but were ultimately ruled out because the criteria was not met. So starting out with depressive and bipolar disorders, it was initially considered because of his upbringing, because he was neglected. Because of these things, because he was raised in a neglectful upbringing where he did not receive an adequate amount of care or affection, we figured that depression could have been a viable symptom along with bipolar disorders, but it was ruled out because these criteria here were not met. He did not experience any kind of diminished interest or pleasure in daily activities. He definitely did not feel worthless. If anything, he valued himself very much, and he, from what it seems like, never felt any level of guilt. And and there are some other ones that aren't applicable as well, like weight loss, insomnia, etc. And then the other one that we considered was schizophrenia, and that's And so with schizophrenia, although Tom does not show any signs of delusion or distorted perception of reality, he does show some signs of asociality, because it seems like he's unable to empathize or form close relationships with others, but that really came from his selfish choices and manipulative personality rather than actually lacking the capability to do these things. So the diagnosis that we came up with is one that is comorbid of both narcissistic personality disorder and antisocial personality disorder. So starting out with the primary diagnosis, antisocial personality disorder, or as the textbook says, a cluster called Factor 1, which is also known as psychopathy. These are some of the symptoms that's cited from Pearson. Lack of remorse or shame for harmful acts committed to others, poor judgment and failure to learn from the experience, extreme egocentricity and incapacity for love, lack of emotional responsiveness to others, impulsivity, absence of nervousness, and a combination of unreliability, untruthfulness, and insincerity, which all of the above fits Tom Riddle's upbringing, his personality, his behavior, the way how he operated at Hogwarts. It was even to the point where he became extremely dangerous, where he murdered and was responsible for thousands of deaths. Then the next one is a narcissistic personality disorder, which also coincides a little bit with antisocial personality disorder, except it focuses a little bit more on an exaggerated sense of self-importance, sense of entitlement, and overall he had very little regard for other people while having an unusually high regard for himself.
Hi, my name is Amalia, and I'm going to be presenting the analysis of Tom Riddle. Voldemort, also known as Tom Riddle, depicts psychopathy in the following ways. From a very early age, he felt that he was better than everyone. He also tormented a lot of his classmates, a lot of the other orphans that were in the same orphanage with him. He goes on to kill his own father and grandparents when he's very young. As he ages, he continues to prove that he has no sense of value for human life, killing hundreds of people and destroying families. He even goes as far as trying to murder an innocent baby, Harry Potter. This shows the ultimate lack of emotion or compassion that he carries. At no point in his life does he ever form a bond with another human being. He never considers anyone a friend or a partner. He sends his followers off to do his bidding, no matter how dangerous, because he has no attachment to them and does not care if they perish. He depicts narcissistic personality disorder in the following ways. He feels that he is the most powerful and important wizard of all time. He finds everyone around him to be completely inferior to him. He is obsessed with the idea of being the leader of the wizarding world. He lacks sensitivity and emotional responses to others. As an example, he accused Hagrid, his classmate, of opening the Chamber of Secret and releasing a murderous monster. When in fact he did it. The reason he blamed his classmate was because he saw weakness in Hagrid and deemed him an inferior being, and he took advantage of that. As another example, he believes that anyone without magical powers or anyone born to non-magical parents should be destroyed because they are not worthy of life. He surrounds himself with pureblood wizards.
Hi, my name is Julia Liu, and I'm going to be presenting the treatment plan. So before we start to talk about the treatment, we have to understand that Voldemort not gonna cooperate to getting any kind of treatment, because therapy normally requires patients to participate actively in their own recovery. Thus, any kind of management for either of his disorders would prove difficult. So unfortunately, to the best of the scientific knowledge, there's no cure for the psychopathy. And there's no pill that can instill empathy or morality. So however, psychotherapy is sometimes used to treat antisocial personality disorder. Therapy may include, for example, anger and violence management, treatment for substance abuse, and treatment for other mental health conditions. But psychotherapy is not always effective, especially if symptoms are severe and the person can admit that he or she contributes to serious problems. So, first of all, the narcissistic personality disorder do not respond to any medications, so we're gonna do psychological treatments for him. So he should start treatments via different forms of therapy in a residential mental health treatment facility. So inpatient recovery programs for narcissistic personality disorder offer an intense and focused therapeutic experiences. So, in addition to being characterized by inaccurate and self-destructive beliefs about oneself and others, NPD is often marked by deficiencies in certain skills that prevent patients from adapting to change, and other environmental and contextual factors serve to reform destructive behaviors. So the cognitive behavior therapy, including the cognitive restructuring, that is the process of learning to identify irrational thoughts known as cognitive distortions and replace them with rational thoughts. And we also have behavior modification, learning to replace harmful behaviors with those that are not healthy. And we also have the exposure therapy that gradually expose a situation that they fear, so they become less sensitive to it over time. So we other than the cognitive behavior therapy, we also have ultimately, when assessing the content of Voldemort's board disorders, we would recommend that he would admit to a psychiatric facility. Unfortunately, Voldemort is unlikely to respond or cooperate with any form of therapy in which he could benefit. Thus, it is vital that he be admitted to a facility in which he can be in an environment where he has no harm to himself or others.